You know, there's a lot of people that have problems with erectile dysfunction, and they try different medications like Viagra. I think there's about 4 more that they might try, and sometimes it will help them, sometimes it doesn't, and sometimes it can give them side effects. And of course, the ideal situation would be to find the root cause and correct that, or at the very minimum, take something that doesn't give you all these other side effects, because there's quite a few side effects, not to mention the small ones like headache, low blood pressure, dizziness, but also heart attacks. So there are dangerous side effects to taking any medication. Of course, with this video, I'm not telling you not to take any medications. Check with your doctor before implementing what I'm going to recommend. Now, if you research this problem, you're going to find, they'll say it's complex. There's a lot of unknowns. There's a combination between hormonal imbalances, neurological problems, and a vascular problem, with risk factors being aging, smoking, drinking, obesity, diabetes, stress, heart disease, and inflammation. Well, that's all fine, but what's really at the heart of this problem? That's what I want to know. I always get clues by studying the mechanism of how medications work. So if we look at Viagra, for example, it works by inhibiting a certain enzyme. In fact, most medications either inhibit an enzyme or stimulate an enzyme. Enzymes in the body are proteins, and they do certain functions in the body. And so with the case of Viagra, it inhibits this PDE5, which is involved with smooth muscle of someone's penis. Now, to make this really simple, there's a whole cascade of effects that occur when you take this enzyme inhibitor, okay? With the end result being enhanced nitric oxide, which affects the nerves and the arteries, which gives you a prolonged erection because the smooth muscle is now relaxed, allowing blood flow into the penis without the venous flow coming out. So basically, it keeps the blood flow from leaving, okay? And so that is how this medication works. And of course, the question I have is there a natural PDE5 inhibitor? And the answer is yes, there is, and there's some other solutions. This mechanism works indirectly. There are other treatments that work directly by increasing nitric oxide, which again does this thing I just mentioned right here. Like, for example, there's a nitroglycerin cream, which has less side effects. It has a direct effect. It works quicker, but it does have side effects, and you have to go to the doctor and they have to adjust the dosage. Some people also use something called ல்-ஆர்ژنין, which is an amino acid, which actually there's some studies that shows that it works. So that's another option that you have. I've done videos in the past about zinc. Well, zinc will increase testosterone and it will increase sperm count, but apparently there's no real studies that I could find that it will help someone with erectile dysfunction. But these are the 4 things that I'm going to focus on today. Number 1, fasting. Yeah, and I'm going to put these studies down below. Fasting can actually increase nitric oxide. And there's been a lot of success stories that I've heard over the years where people start to improve erectile dysfunction once they start fasting. Of course, that's probably because they have blood sugar issues, either they're overweight or they have diabetes or insulin resistance. So, of course, fasting is going to correct that. There's also herbal versions of this enzyme inhibitor, okay? Horny goat weed, forskolin, as well as black ginger. So a lot of people get results with these, and they have much less side effects. Also, exercise, specifically weight training and or intense exercise with good recovery, because if there's too much stress and not enough sleep, that's going to nullify the results. But this is another one that is credible, and there's some great studies on that. And number 4, which I want to talk about, which is an interesting modality. It's called low intensity shockwave therapy. Now, this term shockwave kind of scares people, but it's low intensity shockwave, okay? Apparently, they use this therapy for a lot of different things with different intensity of waves. They can use it to break up kidney stones. They use it for bursitis, tendinitis, because if you lower the intensity of a wave, you can create an anti-inflammatory effect. But with these devices, which they have like centers that you can go to get this procedure done, and they also have do-it-yourself devices, what it does is it creates a micro trauma, okay? A very small trauma, just like exercise, which then results in increased blood vessels called neovascularization, as well as breaking up plaquing if there's plaquing in the penis. So apparently it's a great rehab with some pretty hardcore placebo-controlled clinical trials, with some studies that show up to 70% results. The thing I like about this is there's very minimal side effects. So something to research. I've given you 4 things right here. And there's just one last point I want to emphasize, and that is stress, okay? If someone is stressed out, they're not going to be sleeping. So if they're not sleeping, okay, they're going to be on the sympathetic or flight or fight dominant mode. They're going to have low amounts of parasympathetic. As far as the underlying cause, we have a situation where the person is usually sympathetic dominant. They're usually not sleeping that great. They're usually stressed out. They have a low parasympathetic reserve, so it's going to be very difficult to maintain an erection. So another really important point that goes beyond diet is really handling this recovery, stress, sleep situation. And for that data, you should probably watch this video right here.